Institute of Nursing. Please occupy the all guest seat. Third national level workshop on innovative normal delivery and simulation training on PPH. A very good morning, everyone. Now we will see our
बल, बुद्धी आणि सद्विचारासाठी शिक्षण हे ब्रीद घेऊन पुण्यनगरीत गरिबांच्या मुलांना अल्प दरात KG to PG व्यवसायाभिमुख शिक्षण देऊन त्यांना 100% प्लेसमेंट असिस्टंट देत त्यांचा शैक्षणिक, सामाजिक, आर्थिक, राजकीय, औद्योगिक, कला, क्रीडा, सांस्कृतिक, विज्ञान आणि संशोधन अशा सर्व क्षेत्रात सर्वांगीण विकास व्हावा म्हणून कटिबद्ध असलेली पुण्यातील फास्टेस्ट ग्रोईंग शैक्षणिक संस्था म्हणजे जाधवर ग्रुप ऑफ इन्स्टिट्यूट. उच्च विद्याविभूषित प्राचार्य डॉक्टर सुधाकरराव जाधवर आणि ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांच्या कुशल नेतृत्वाखाली संस्था आज प्रगतीपथावर आहे. पूर्व प्राथमिक, प्राथमिक, माध्यमिक, कनिष्ठ विद्यालय, BA, BCom, MA, MCom, BBA, BCA, BCS, DSM, DMLT, DEd, BEd, MBA, PGDM, ANM, GNM, CBSE, इंग्रजी माध्यम तसंच मराठी माध्यम असे एकाच छताखाली विविध अभ्यासक्रम या संस्थेच्या विविध कॅम्पसमध्ये शिकवले जातात. यशवंतराव चव्हाण मुक्त विद्यापीठ आणि सावित्रीबाई फुले पुणे विद्यापीठ या दोन्ही विद्यापीठांचे सर्व एक्सटर्नल अभ्यासक्रमही इथे उपलब्ध आहेत. शिवाय बदलत्या काळाचा विचार करून संस्थेमध्ये ऍक्टिंग, डान्स, सिंगिंग, फोटोग्राफी आणि स्किल डेव्हलपमेंट हे कोर्सेस सुद्धा शिकवले जातात. तर योगा आणि मेडिटेशन सारखे वर्ग कॅम्पसमध्येच घेतले जातात. तसंच 9वी आणि 10वीच्या विद्यार्थ्यांना JEE आणि नीट यासारख्या परीक्षांची तयारी करता यावी म्हणून IIT मधून शिक्षण घेतलेल्या तज्ञ प्राध्यापकांकडून संस्थेत मोफत क्लासेस घेतले जातात. 2014 साली सुरू झालेल्या जाधवर ग्रुप ऑफ इन्स्टिट्यूट मध्ये आज 25,000हून अधिक विद्यार्थी शिक्षण घेतात, तर 1500 शिक्षक आणि शिक्षकेतर कर्मचारी काम करतात. संस्थेचा शैक्षणिक दर्जा टिकावा म्हणून शिक्षक भरती करताना त्यांच्या लेखी आणि तोंडी परीक्षा घेतल्या जातात. प्रसन्न आणि सुंदर कॅम्पस, प्रशस्त आणि अद्ययावत क्लासरूम, वर्गात डिजिटल बोर्ड, KG to PG ई-लर्निंग, विद्यार्थ्यांच्या उपस्थितीची डिजिटल नोंद, उच्च शिक्षित आणि अनुभवी प्राध्यापक, थेअरी सोबत प्रॅक्टिकल शिक्षणावर भर, विविध क्षेत्रातील तज्ञांचं मार्गदर्शन असं विद्यार्थ्यांच्या सर्वांगीण विकासाला पोषक असं शिक्षण हे या संस्थेचं वेगळे. भारतीय संस्कृतीसोबत अमेरिकन तत्वज्ञानाचा अवलंब करून आंतरराष्ट्रीय दर्जाच्या शिक्षणाची संधी इथे विद्यार्थ्यांना मिळते. सशक्त युवा, सशक्त राजकारण, सशक्त भारत व्हावा या उद्देशाने त्यांनी गेल्या अनेक वर्षांपासून युवा संसद सुरू केली. महाराष्ट्र आणि गोवा या राज्यातनं या संसदेत विद्यार्थी सहभागी होतात. केंद्र शासन, राज्य शासन, लायन्स क्लब इंटरनॅशनल आणि नेहरू युवा केंद्राच्या संयुक्त विद्यमाने ही युवा संसद चालवली जाते. या कार्यक्रमात आजपर्यंत महाराष्ट्र आणि महाराष्ट्राबाहेरील मंत्री, मुख्यमंत्री अशा अनेक मान्यवरांना सन्मानित करण्यात आलं आहे. विद्यार्थ्यांच्या विकासासाठी महाविद्यालयात विशेष शौर्यासाठी शौर्य पुरस्कार, डॉक्टर सुधाकर जाधवर करंड जाधवर सायन्स फेअर, नशामुक्ती अभियान, मदिरा छोडो दूध पियो हा 31 डिसेंबरला उपक्रम, राज्यस्तरीय निबंध आणि वक्तृत्व स्पर्धा, जाधवर फेस्टिवल, कीर्तन महोत्सव, जाधवर स्पोर्ट्स फेस्टिवल, आदर्श माता पुरस्कार, भारतरत्न डॉक्टर बाबासाहेब आंबेडकर व्याख्यानमाला, आदर्श शिक्षक पुरस्कार हे उपक्रम राबवले जातात. जाधवर सायन्स फेअर मध्ये विद्यार्थ्यांना 10 लाख रुपयांपर्यंत संशोधनाला प्रोत्साहन आणि पेटंटसाठी आर्थिक सहाय्य केले जाते. कंबा आणि शिका योजनेअंतर्गत 50 विद्यार्थ्यांना संस्थेत नोकरीची संधी दिली जाते. आर्मी, पोलीस, पत्रकार, फायर ब्रिगेड, अँब्युलन्स चालक या क्षेत्रात काम करणाऱ्या पालकांच्या मुलांना या शैक्षणिक संस्थेत KG to PG पर्यंत शैक्षणिक शुल्कात 50% सवलत दिली जाते. तर मुलींसाठी 11वी ते PhD पर्यंत विशेष स्कॉलरशिप दिली जाते. आज कुठल्याही शैक्षणिक संस्थेचा दर्जा हा तेथील विद्यार्थ्यांना मिळणाऱ्या प्लेसमेंट आणि पॅकेजवर गणला जातो. मॅजिक बस, जस्ट टाइम, रुबी हॉल, HDFC बँक, बजाज अलियन्स, फ्लिपकार्ट, टाटा कॅपिटल, टाटा AIG, विप्रो, सह्याद्री हॉस्पिटल अशा नामांकित कंपन्या दरवर्षी या संस्थेतील विद्यार्थ्यांना कॅम्पसमध्ये मुलाखती घेऊन नोकरीच्या संधी देतात. 100% विद्यार्थ्यांना इंटर्नशिपसाठी संस्थेमार्फत संधी देतात. लवकरच 1000 एकर क्षेत्रावर विद्यापीठ स्थापनेचा संस्थेचा मानस आहे. रिअल इस्टेट, बांधकाम, हॉटेल, सेवा, चित्रपट निर्मिती अशा विविध उद्योग क्षेत्रातही जाधवर ग्रुप अग्रेसर. पुणे या विद्येच्या माहेरघरात फास्टेस्ट ग्रोईंग असणारी ही शैक्षणिक संस्था लवकरच महाराष्ट्रातील फास्टेस्ट ग्रोईंग शैक्षणिक संस्था बनण्याच्या दिशेने वेगवान वाटचाल करत आहे. त्यांच्या या वाटचालीला हार्दिक हार्दिक शुभेच्छा.
जब लेकिन ऐसे नौजवान लड़के और लड़कियां राजनीति के अंदर आएंगे तो देश के अच्छे दिन आने वाले हैं, ये आप समझ लीजिए.
युवा शक्तीला योग्य गती आणि दिशा देऊन समाजकारण राजकारणामध्ये अधिष्ठान निर्माण करण्याकरता आणि सशक्त युवा, सशक्त राजकारण, सशक्त भारत व्हावा या उद्देशानं जाधवर ग्रुप ऑफ इन्स्टिट्यूटनं 2016 पासून युवा संसद सुरू केली आहे.
तरुण वर्गाला काहीतरी ॲस्पिरेशन्स आहेत. ॲस्पिरेशन्स असणं खूप गरजेचं आहे. जर पुढे काही आपल्याला करायचं असेल तर आपल्यामध्ये इच्छाशक्ती असली पाहिजे. ती इच्छाशक्ती आपल्या सगळ्यांमध्ये बघून खरंच खूप अभिमान वाटतो.
देशातील लोकशाही बळकट व्हायची असेल तर सुशिक्षित युवकांनी राजकारणात आलं पाहिजे हा विचार घेऊन युवा संसदेच्या माध्यमातून 1000हून जास्त युवक राजकारणाच्या मुख्य प्रवाहात आणण्यासाठी जाधवर ग्रुप ऑफ इन्स्टिट्यूटनं उचललेलं हे पाऊल समाजाला वेगळी दिशा देणारं आहे.
आताच्या राजकारणामध्ये जर का तुम्हाला टिकून राहायचं असेल तर तुमची फेस व्हॅल्यू ही आता आपण स्वतः त्या ठिकाणी क्रिएट करायला शिकलं पाहिजे. जोपर्यंत तुमची फेस व्हॅल्यू तुम्ही समाजापुढे नेऊन ठेवू शकत नाही तोपर्यंत समाज किंवा नागरिक तुमच्यापर्यंत आकृष्ट होऊ शकत नाही. अशी सध्याच्या राजकारणाची परिस्थिती आहे.
हिंदुस्थानी हे एकच जात असणं हे अत्यंत गरजेचं आहे.
समाजासाठी चांगले नेतृत्व निर्माण करणं हा महत्त्वाचा उद्देश डोळ्यासमोर ठेवून प्रभावी नेतृत्व करणारे चेहरे युवकांच्या समोर आणून त्यांना प्रेरणा देण्याचं काम या माध्यमातून सुरू आहे. तुमच्या पाठीशी किती जण आहेत हे मोजण्यापेक्षा तुम्ही किती जणांच्या पाठीशी उभे आहात हे युवकांना कळावं हा विचार युवकांच्या मनात प्रभावीपणे रुजवण्याचं काम या संसदेत विचारांचं मंथन करून केलं जातं.
परंतु बांधवांनो, तुम्हाला तुमचं चॅलेंज आणि रस्ता तयार करायचा असेल तर स्वतःच्या दिमागाने चालण्याचा प्रयत्न करा. सारं पैशावर होतं काय असं नाही, काय गरज नाही पैशाची. फक्त डेडिकेशन, डेवोशन आणि डिटर्मिनेशन पाहिजे. त्याग करायची, कष्ट करण्याची कुवत पाहिजे. आणि मलाच पाहिजे म्हणायची गरज नाही. मलाच पाहिजे, मलाच चेअर पाहिजे बिलकुल नाही. जनतेनं म्हणलं पाहिजे की तुम्ही बसावं.
महाराष्ट्र, गोवा राज्यातून या संसदेत विद्यार्थी सहभागी होतात. सावित्रीबाई फुले पुणे विद्यापीठ, लायन्स क्लब इंटरनॅशनलच्या संयुक्त विद्यमानं ही युवा संसद चालवली जाते. या संसदेत आजपर्यंत महाराष्ट्र आणि महाराष्ट्राबाहेरील राज्यातील मुख्यमंत्री, मंत्री अशा अनेक मान्यवरांना सन्मानित करण्यात आलंय. तसंच समाजात निस्वार्थीपणे समर्पण भावनेतून उल्लेखनीय कार्य करणारे आदर्श सरपंच, पंचायत समिती सदस्य, जिल्हा परिषद सदस्य, आमदार, खासदार, मंत्री, पत्रकार, प्रशासकीय अधिकारी यांना विविध पुरस्कारानं सन्मानित केलं जातं.
मध्यमवर्ग काय म्हणतं, नको बाबा राजकारण, आम्हाला राजकारण नको, याचं राजकारण घाण आहे. अरे घाण आहे तर साफ करायला उतरा गटारात, तर साफ होईल, लक्षात घ्या. त्यामुळे माझी तरुण मुलांना ही विनंती आहे, आई वडिलांनी जरी सांगितलं राजकारण खराब आहे तर ते अजिबात ऐकू नका. आपण चांगले असू, आपण ठरवलं भ्रष्टाचार करायचा नाही, आपण ठरवलं सचोटीने वागायचं, आपण ठरवलं सामान्य माणसाची बांधिलकी ठेवायची,
तर आपलं राजकारण चांगलं होऊ शकतं.
युवा संसदेत शैक्षणिक, सामाजिक, आर्थिक, राजकीय, औद्योगिक, कला, क्रीडा, सांस्कृतिक, विज्ञान आणि संशोधन क्षेत्रातील व्यक्तींचं बहुमूल्य मार्गदर्शन युवकांना दिलं जातं. विविध सामाजिक आणि राजकीय क्षेत्रांवरील विषयांवर विस्तृतपणे चर्चा करून संबंधित अहवाल विविध राज्यातील राज्यपाल, मुख्यमंत्री, संबंधित विभागाचे मंत्री यांना पाठवण्यात येतो.
कि मंजिल मिले ना मिले ये मुकद्दर की बात है, हम कोशिश भी ना करें ये गलत बात है.
उच्च विद्या विभूषित संस्थापक अध्यक्ष प्राचार्य डॉक्टर सुधाकरराव जाधवर आणि उपाध्यक्ष ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांच्या कुशल नेतृत्वाखाली या संस्थेने राबवलेला युवा संसद हा अभिनव उपक्रम जगात सर्वात मोठ्या असलेल्या आपल्या देशातील लोकशाही बळकटीकरणाला नक्कीच हातभार लावेल असा विश्वास वाटतो.
40 वर्ष माणसांमध्ये काम केल्यामुळे डोळे माझे खूप शार्प आहेत, कानही माझे खूप शार्प आहेत, ते पटकन विश्लेषण करतात. त्याच वेळेला मला जाणवलं की खूप गट्स असणारा मुलगा आहे, खूप गट्स असणारा मुलगा आहे. आणि आज इथे शांतपणे सगळं त्याचं पाहता पाहता असं लक्षात आलं की हा खूप मोठा माणूस होऊ शकतो. असा या युवा संसदेचा एका अर्थाने संयोजक आणि या ट्रस्टचा उपाध्यक्ष शार्दूल जाधवर.
जाधवर ग्रुप ऑफ इन्स्टिट्यूटच्या या प्रयत्नांना असंच यश लाभत राहो ही सदिच्छा.
Journey from darkness towards light, so I invite all the guests to kindly enlight the lamp. Occupy the seat on the dais. I request all guests kindly occupy the seat on the dais. Please, ma'am. Now our audience and our respected dignitaries to be kindly enough to stand up for the national anthem. See. It's my absolute pleasure to extend a hearty welcome to each one of you present here at 3rd National Level Workshop on Innovative Normal Delivery and Simulation Training on PPH. Our President, Honorable Principal Dr. Sudhakar Rao Jadhavar Sir, our Secretary, Honorable Advocate Shardurrao Sudhakar Rao Jadhavar Sir, our Treasurer Ma'am, Honorable Mrs. Surekhatai Jadhavar Ma'am, they are always encourage us for conducting such a type of program for our student. Principal Dr. Sudhakar Rao Jadhavar Sir, he is founder and president of Jadhavar Group of Institute. Sir has completed M.Com, MA, LLM, DTL, DLL, GDC and PhD. General Secretary Akhil Maharashtra Federation of Association on Non-Government Colleges, member of Maharashtra Nursing Counseling, General Secretary of Principal Forum Savitribai Phule Pune University, EX Dean Faculty of Commerce Savitribai Phule Pune University, member of Management Counseling Savitribai Phule Pune University. Sir always motivate us. Sir has given this platform to enhance our skill and knowledge and given opportunity to us.
Our treasurer, Mrs. Surekhatai Jadhavar ma'am, she is one of pillars of Nursing Institute. She always helps and guide us her motivation, always encourage us and continuously support our heart fills with gratitude and lots of respect. It gives me immense pleasure to welcome you all this special event. We are truly honored by your presence today. We are thrilled to have shared this moment occasion with us. I would like to welcome Mrs. Surekhatai Jadhavar ma'am. I would like to welcome today's speaker, Dr. Mrs. Kalpana Kamble ma'am, Principal College of Nursing, BJ Medical Government College and Sassoon Hospital, Pune. I would like to welcome today's speaker Dr. Mrs. Supriya Potalre ma'am, Associate Professor Bharati Vidyapeeth College of Nursing, Pune.
I would like to welcome today's speaker Mrs. Jasmine Jesse ma'am, Associate Professor Sadhu Vaswani College of Nursing, Pune.
I would like to welcome today's speaker Mrs. Sonali Manjure ma'am, late Uddhavrao Tulsiram Jadhavar Foundation Institute of Nursing.
I would like to welcome to all respected teachers on this special occasion.
Dear students, welcome you with a sense of pride and excitement.
Today, our first speaker is Dr. Kalpana Kamble ma'am. Ma'am has professional qualification, PhD Nursing, Krishna Institute of Medical Science and Deemed University, Karad. MSc Obstetrics and Gynecological Nursing, Lilabai Thakre College of Nursing, SNDT, Women's University, Mumbai. Ranked first in clinical specialty in MSc Nursing, awarded with gold medal. PBSc Nursing from Institute of Nursing Education, JJ Hospital, Mumbai. General Nursing and Midwifery from College of Nursing, JJ Group Hospital, Mumbai. Ma'am has professional experience, Principal College of Nursing, BJ Medical Government College and Sassoon General Hospital, Pune. Teaching experience total 23 years in various government nursing colleges. Clinical experience as staff nurse 9 years in Sir JJ Group of Hospitals, Mumbai. Total professional experience 32 years. Ma'am has achievement recognized as PG guided 50 MSc nursing student in Institute of Nursing Education, Mumbai under Maharashtra University of Health Sciences, Nashik. Recognized as PG examiner in various universities. PhD guide and examiner in various universities. Presented research paper in national and international conference. Published more than 23 research papers in national and international journals. Speaker and resource person in state, national and international conference and workshop.
I would like to request Treasurer Mrs. Surekhatai Jadhavar ma'am to felicitate Dr. Mrs. Kalpana Kamble ma'am.
our second speaker, Dr. Supriya Potter Rai, ma'am, Associate Professor, Department of Obstetrical and Gynecological Nursing, Bharati Vidyapeeth College of Nursing, Pune. Ma'am has professional qualification MSc Nursing, PhD Nursing, teaching experience 19 years, additional course completed certificate course from the field of research, education, ICT and management of communicable disease through NPTEL, QASRP and WHO. Special achievement national conference hosted by Dr. D.Y. Patil College of Nursing, Pimpri, Best Research Paper awarded 2016. Master Trainer Global Fund Against AIDS, Tuberculosis and Malaria Neonatal Resuscitation Program. Faculty Exchange Program selected a mentor for Swedish and Norway students in India under Faculty Exchange Program with Maladen University, Sweden and USN University, Norway. Gold Medalist Lottery Awards, MSc Nursing 2009 Appreciation Award for Best Student 2007 to 2008. Publication, research publication 30 national and international. Research guidance, UG program, PG program, PhD thesis evaluated 7. Examinership, internal for UG and PG course, Bharati Vidyapeeth College of Nursing, Pune. External for UG and PG courses, MHS, Dr. D.Y. Patil University, Pune, Symbiosis International University, Pune, PIMS, Loni. External for PhD, MGM University, Navi Mumbai, Jujunan, Rajasthan. Administrative contribution, course of co-coordinator for UG 8 years, PG nursing courses 10 years, 2017 till date. IAQAC and NAC coordinator, organizing team member of Bharati Vidyapeeth College of Nursing, Pune for faculty development programs, conference, workshop, seminars. Membership, Trained Nurse Association of India, TNAI, Nursing Research Society of India, Indian Association of Neonate Nurse, Society of Midwives India, on University Panel, Board of Studies, Bharati Vidyapeeth, Pune, Research Advisory Community, member of PhD Scholars at Bharati Vidyapeeth, Pune, Research Review Committee at Bharati Vidyapeeth College of Nursing, Pune, Conference Workshop Attendant 22.
I would like to request Treasurer Mrs. Surekatai Jadhavar ma'am to felicitate Dr. Mrs. Supriya Potter ma'am.
Jasmine J.C. Ma'am has Associate Professor Sadhu Vaswani College of Nursing, Pune. Academic qualification, Husungi PhD 2020 to 2026 from Dr. D.Y. Patil College of Nursing, Pimpri. MSc Nursing 2010, BSc Nursing 2007. Academic experience, ma'am. Current work experience 14 years of teaching experience. Coordinator of various UG and PG batch of Yasvik COCon. Guided many UG groups project and PG research guide. Published several research articles in national international journals. Coordinate various workshop and skill station in midwife practices. Resources person of various workshop in midwifery. MUHS theory and practical internal and external examiner. Ma'am has lifetime membership Society of Midwives India and TNAI.
I would like to request Treasurer Mrs. Surekatai Jadhavar ma'am to felicitate Mrs. Jasmine J.C. ma'am.
Fourth speaker, Mrs. Sonali Manjule ma'am, has completed MSc Nurse in Obstetric and Gynecological Nursing in Siagat College of Nursing, Pune. BSc completed in MGM Mother Teresa College of Nursing, Sambhajinagar. Experience, clinical experience as a staff nurse, 1.5 years in Dinanath Mangeshkar Hospital, Pune. Research conduct on permanent family planning method.
I would like to request Treasurer Mrs. Surekatai Jadhavar ma'am to felicitate Mrs. Sonali ma'am. I would like to request Principal Mrs. Sheetal Nikam ma'am to felicitate Treasurer Mrs. Surekatai Jadhavar ma'am.
Thank you, ma'am. Mrs. Sheetal Nikam ma'am is principal of late Uddhavrao Tushram Jadhavar Foundation Institute of Nursing. Work experience 10 years plus experience in the field of nursing profession. Work as nursing tutor in Godra School of Nursing in Uttarakhand State from 1 May 2013 to 13 May 2016. Work as staff nurse in Wadia Cardiology Hospital, Pune from 1st January 2017 to 30 January 2017. Work as nursing tutor in late Uddhavrao Tushram Jadhavar Foundation Institute of Nursing, Pune from 1st April 2017 till date. As a delegate, attended more than 10 conferences and workshops to update. As an organized secretary, 4 national workshops organized. Ma'am has merit and awards. Best Teacher Award from Kodra Institute of Nursing, Rocky, Uttarakhand in 2015. Best Principal Award from 2016 to 2020. For being the catalyst that stimulate us to do our best and standing as pillars of strength with a deep sense of appreciation, we'll all thank our loving faculty for their untiring efforts.
I request Principal Mrs. Sheetal Nikam ma'am give introduction our institute and workshop.
A very good morning on this beautiful and wonderful morning. I am Mrs. Sheetal Bhosle, Principal of late Uddhavrao Tulsiram Jadhavar Foundation Institute of Nursing. Have the honor to welcome you all to this very important program that is introducing our institute and workshop. I welcome respected Principal Dr. Sudhakar Jadhavar sir, President of Jadhavar Group of Institute, Advocate Shardul Sudhakar Jadhavar, Secretary of Jadhavar Group of Institute, our Treasurer Ma'am, Mrs. Surekatai Jadhavar Ma'am. I welcome today's workshop speakers, Dr. Mrs. Kalpana Kamble Ma'am, Principal of College of Nursing, BJ Medical College and Sasun Hospital. I welcome Dr. Mrs. Supriya Pottal Ray, Associate Professor, Bharati Vidyapit College of Nursing, Pune. I welcome Mrs. Jasmine Jesse Ma'am, Associate Professor, Sadhu Vasami College of Nursing, Pune. I welcome Mrs. Sonali Manjule Ma'am, late Uddhavrao Tulsiram Jadhavar Foundation Institute of Nursing, Pune. I welcome to all my teachers and all my dear students who came from different institutes. Late Uddhavrao Tulsiram Jadhavar Foundation Institute of Nursing has established in 2011 with an aim of enhancing healthcare professionals in such way that they can success in the modern system of healthcare and research. President of Institute is Dr. Sudhakar Jadhavar sir, Secretary is Advocate Shardul Sudhakar Jadhavar sir, and Treasurer is Mrs. Surekatai Jadhavar ma'am. Institute is having well ventilated classrooms with a capacity of 60 students. Each classroom equipped with LCD projector and internet. We have 5 well equipped labs, dummies and articles are available for the clinical practices. Separate computer lab is available. We have spacious library hall with reading room. 100% job placement is available from the institute. Government scholarship facility are available. Institute is affiliated with Ruby Hall Clinic, Pune, Inamdar Multi-Speciality Hospital and Unani Hospital. Moreover, students are posted to Kamla Nehru Hospital, Sonone Hospital and PHC Khadakwasla. All students are accompanied by trained teachers. Today's workshop is very important in nursing education. Maternal and child health is very important to our India. So we have selected workshop on innovative normal delivery and simulation training on PPH. The main goal of maternal child health care is to provide comprehensive, preventive, promotive, curative and rehabilitative services from mother and children so that they attain a high level of health. All women need access to antenatal care in pregnancy, skilled care during childbirth, and care and support in the weeks after childbirth. Nursing students, when our nursing students will pass their course, then they can apply this knowledge in their clinical practice very easily. We have 4 sessions in workshop. In first session, we will see about the normal labor pattern. This session will be conducted by Dr. Mrs. Kalpana Kamble ma'am. In session second, we will see about the newer modalities on induction of labor. This session will be conducted by Mrs. Jasmine Jesse from Sadhu Vasami College of Nursing, Pune. In session third, we will see simulation training on PPH. This session will be conducted by Dr. Mrs. Supriya Pottalre. In session 4th, we will see improving maternal and child health, that is 4th stage of labor. This session will be conducted by Mrs. Sonali Manjule from late Uddharao Tulshirao Jadhavar Foundation. I hope students will be able to know how to reduce maternal and infant mortality and morbidity rate from this workshop. I hope they will apply this knowledge in their clinical practice. I would like to extend my heartfelt gratitude to our esteemed management, Dr. Sudhakar Rao Jadhavar sir, Advocate Shardul Sudhakar Rao Jadhavar sir, Mrs. Surekatai Jadhavar ma'am, that I got such honor to be a part of this wonderful workshop. I would like to welcome to all student nurses, teachers and all speakers. Those are came from today's workshop from different institute. Thank you.
Thank you, ma'am. Thank you, ma'am. Advocate Shardulrao Sudhakarrao Jadhavar sir is the secretary of Jadhavar Group of Institute. He is president of Yuva Sansad, Dr. Sudhakarrao Jadhavar Social and Educational Trust Pune and Aditya Education Foundation Pune. The world is full of diamond and gems and we are having some of them here today to build this event. Sorry, but our Secretary Advocate Shardulrao Sudhakarrao Jadhavar sir could not come for some reason. Sir has sent us the video clip and sir has sent his valuable regards for our workshop.
मुश्किलें जरूर हैं मगर ठहरा नहीं हूं मैं, मंजिल से जरा कह दो अभी पहुंचा नहीं हूं मैं. युवक हा केंद्रबिंदू मानून देशाची ध्येय धोरणं राबवली तर भारत महासत्ता राष्ट्र झाल्याशिवाय राहणार नाही असं मानणार आणि आपल्या शैक्षणिक संस्थेत शिकणाऱ्या विद्यार्थ्यांचा सर्वांगीण विकास होण्यासाठी कटिबद्ध असणारं व्यक्तिमत्व म्हणजे ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर. धाराशिव जिल्ह्यातील वाशी तालुक्यातील वडजी या खेडेगावात ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांचे वडील प्राचार्य डॉक्टर सुधाकरराव उद्धवराव जाधवर यांचा जन्म झाला. घरच्या आर्थिक संकटांवर मात करत आपलं शिक्षण घेत असताना प्राचार्य डॉक्टर सुधाकरराव उद्धवराव जाधवर सरांनी समाजाप्रती असणारी बांधिलकी कधीही कमी होऊ दिली नाही. पुण्यात येऊन प्राध्यापकाची नोकरी करता करता त्यांनी अनेक शैक्षणिक संस्था उभ्या केल्या. उत्तम वक्ता, विद्यापीठात अधिष्ठाता, बांधकाम आणि हॉटेल व्यावसायिक, जाधवर ग्रुप ऑफ इन्स्टिट्यूटचे अध्यक्ष अशा एकाच वेळी अनेक पदांवर ते कार्यरत आहेत. पुणे विद्यापीठाच्या व्यवस्थापन परिषदेवर सदस्य म्हणूनही त्यांनी 5 वर्ष काम केले. अशा या कर्तृत्ववान व्यक्तीच्या घरात ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांचा जन्म पुण्यात झाला. अतिशय कमी वयात ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांनी जाधवर ग्रुप आणि जाधवर ग्रुप ऑफ इन्स्टिट्यूटच्या उपाध्यक्षपदाची धुरा सांभाळली. ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांनी डिप्लोमा इन ह्युमन राईट्स, डिप्लोमा इन लेबर लॉ, डिप्लोमा इन कॉर्पोरेट लॉ, सायबर लॉ, एमकॉम, LLB, MBA, PGDHRM, LLM अशा अनेक पदव्या त्यांनी कमी वयातच संपादन केल्या. 1995 साली एका कन्या शाळेपासून सुरुवात झालेला शिक्षण संस्थांचा हा प्रवास आज 80 शाखांपर्यंत पोहोचलाय. त्यापैकी 40 शैक्षणिक संस्थांची जबाबदारी ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर स्वतः सांभाळतात. ॲडव्होकेट शार्दूलराव सुधाकरराव जाधवर यांना आजपर्यंत महाराष्ट्र रत्नभूषण पुरस्कार, दिल्ली येथील राष्ट्रीय एकता पुरस्कार अशा वेगवेगळ्या 40 पुरस्कारांनी सन्मानित करण्यात आलं आहे. भविष्यात जन्मभूमी आणि कर्मभूमी या ठिकाणी 1000 एकर क्षेत्रावर विद्यापीठ स्थापनेचा जाधवर ग्रुप ऑफ इन्स्टिट्यूटचा मानस आहे. रिअल इस्टेट, बांधकाम व्यवसाय, शिक्षण, हॉटेल, सेवा क्षेत्र अशा अनेक क्षेत्रात जाधवर ग्रुप सध्या कार्यरत आहे. हे सर्व यश मिळवताना वडील प्राचार्य डॉक्टर सुधाकरराव जाधवर सर, आई सुरेखाताई सुधाकरराव जाधवर यांचं मोलाचं मार्गदर्शन असल्याचं ते आवर्जून सांगतात. अशा या कर्तृत्व संपन्न व्यक्तिमत्वाच्या कार्याला मानाचा त्यांचं यशाचं शिखर हे असंच विस्तारत जावं आणि समाजाशी त्यांचं नातं असंच वृद्धिंगत हो यासाठी त्यांच्या शुभेच्छा सदैव त्यांच्या पाठीशी.
Stimulating new ideas.
I would like to request start the first session Dr. Mrs. Kalpana Kamble ma'am. Start please ma'am.
Please, ma'am.
First topic normal labor pattern.
Good morning. Respected all the dignitaries of Jadhavar Group of Institutes, President, Vice President, Secretary, Treasurer Madam, Principal Madam, Dr. Sheetal Kadam, all the faculties from the Jadhavar Institute of Nursing, and all dear students and teachers from the various institutes. Today I got the opportunity to be in front of you because of this 4th national workshop in midwifery on normal labor. So first I would like to thank the organizers, Jadhavar Group of Institutes and Jadhavar Nursing Institute for calling me as a resource person to deal with one of the topic from today's session. So already I introduced myself by the Sutra Sanchalan. So myself, Dr. Kalpana Kamble. I'm working at present in the nursing college, BJP Medical Government College. And today I'm here in front of you. So we are going to start the session. So we want to know about what is the normal labor. So everybody, I think you are the learning midwifery, that's why you are here. So we want to know what is the normal labor, how we are going to take the care of the mother during this first stage of labor. So here we are going to deal more with the first stage of labor, normal labor. So what do you mean by labor? Next. So in this session, we just go through a review. We already familiar maybe with this normal labor. We want to know about what is the normal labor, what is abnormal and normal labor, then stages of labor, how the labor is going to start, what are the causes of labor, then physiology of first stage of normal labor, what are the signs, symptoms, how we can identify now the first stage of labor is started, and how you are going to manage this first stage of labor. Next. Now coming to the labor, definition of normal labor is, or a labor is that a series of events that takes place in the genital organ, कशासाठी? In an effort to expel the viable products of conception out of the womb, that is from the uterus through the vagina into the outer world, is called as a labor. So it is a simple, whatever present in the uterus, so that is a product of conception during the 9 months, that has to be come out. So when it comes out through the vagina, and what are the events taking during this process is called as a normal labor. It may occur prior to the 37 weeks of pregnancy, so that is called as a preterm labor. So when we say it is a normal labor, it should occur 37 and after the 37 weeks of gestation and before the 40 weeks of gestation. Then only we can say it is a normal labor. Otherwise, if it is occurring before 37 weeks or after 40 weeks of pregnancy, it is called as a preterm labor and postterm labor or a post-dated labor. Delivery is the expulsion or extraction of viable products out of the womb. So this is nothing but a normal labor. Now, another word which is used to normal labor, it is etosia. So etosia or dystocia is a abnormal labor. So labor is called normal if it fulfills the following criteria. So when we can say it is a normal labor, first criteria, very important, that is it should be a spontaneous. It should start spontaneously and at the term. So as I said, after the 37 weeks of pregnancy, then it will be a normal labor with vertex presentations. As we know, there are various presentations are there. Cephalic is a normal presentation. There is a buttocks presentation, shoulder presentation, face presentation. These presentations we won't call as a normal labor. Only if it is a vertex or cephalic presentation, then only we can say it is a normal labor. Then without undue prolongation, some duration is decided for each stage of labor. So it should not be prolonged than the given duration. If it is prolonged, then it will not be a normal labor. So that is it should be undue prolongation should not be there. Natural termination with minimal aids. So we should complete the delivery naturally with minimal aids. There should not be any surgical or any intervention to conduct the labor. Otherwise it will not be a normal labor. Then without having any complications affecting the health of the mother and the baby. So during conduction of labor, if anything is happening to the mother or the fetus or the baby during the labor, so it will not be considered as a normal labor. So there should be no complications only during the labor, that is called as a normal labor. So you can go through when we can see a normal labor, it is at a full term. Spontaneous starting is there. There should not be undue prolongation. There should not be any surgical intervention used, and there will not be any complications in the mother and fetus and baby during the labor. Next. If there is any deviation from the normal labor, that is called as a dystocia. So two terms, etosia is a normal labor, dystocia is a abnormal labor. Now coming to the stages of labor, actually while conducting the delivery, we won't see the stages of labor. For the study purpose, we people who are going to study should understand the labor process in a proper way. For that purpose, the labor is divided into 4 stages. The first stage, labor, second stage, third stage and fourth stage. Next. Now coming to the first stage of labor. So as we see, it starts from the onset of true labor pains and ends with the full dilatation of cervix. So that is the duration, starting from the labor pains, true labor pains, until the full dilatation of cervix, that is a 10 centimeter dilatation. That is called as the first stage of labor. Also that stage is called as a cervical stage, because maximum change happening in through the cervix. So that is a cervical stage. The average duration in the primigravida mother is 12 hours. And the multigravida mother who is giving the birth to second time to the baby is less, that is 6 to 8 hours. Next. Now what are the different phases of the first stage of labor? It is again divided into the latent stage, where the less progress of the labor is happening, and the second is this active phase, where the maximum cervical dilatation is taking place. So latent phase is what? Is the time between the onset of labor and 3 to 4 centimeter of dilatation. So very slow dilatation of this cervix is taking place into the latent phase. That's why it is called as a latent phase. We cannot able to see properly this phase. And cervix becomes cervix becomes fully effaced. It usually lasts between 3 and 8 hours, being shorter in multiparous women. So that is a normal first time delivery mother will take 12 hours for this. But when the mother has given the second time birth or third time birth, the duration is going to be minimized as the birth numbers are increasing. In that only the active phase is the stage and describe the time between the end of the latent phase. So after the 3 to 4 centimeter dilatation झाल्यानंतर then becomes a active phase, where full dilatation of the cervix, that is up to the 8 to 10 centimeter of the cervical dilatation is going to take place. It is also variable in length, usually lasting between 2 and 6 hours. Again it is shortened in the multiparous women. Because why multiparous women takes less time? Because the birth canal is already gone through the delivery during the first deliveries or the second deliveries. But the first time delivery mother has not prepared the birth canal. The first time delivery is occurring. That's why the duration for the stage in the first time delivery or the primigravida mother is going to be more than the multigravida mother. Okay. Next. Now what is happening during the second active stage of labor? Cervical dilatation during the active stage usually occurs at 1 centimeter per hour or more in normal labor. So as we said, the latent phase will have a less cervical dilatation, that is only 3 to 4 centimeters during the 6 hours. But in active stage, the 1 centimeter per hour or more than that, depend upon the parity of the mother, the dilatation is going to take place. That's why it is called as a active phase of labor or a first stage. Next. Now coming to the second stage of labor, it is called as a fetal stage. Why? Because it starts from the full dilatation of the cervix and ends with the expulsion of the fetus from the birth canal. It has called again 2 phases. Purposive phase, which starts from full dilatation up to the descent of the presenting part to the pelvic floor. So descent is taken place and now patient is going to be ready to have a delivery. Expulsive phase is distinguished by maternal bearing down efforts and ends with the delivery of the baby. Average duration is 2 hours in primigravida and 1 hour in multigravida. Next. Now coming to the third stage of labor, that is also called as a placental stage, because mainly during this third stage the placenta is going to be delivered. That's why it is a placental stage. So after the expulsion of fetus and ends with the expulsion of placenta and membranes, it also involves the control of bleeding during this stage. A third stage lasting more than 15 to 30 minutes. If it is more than 30 minutes, it is going to be considered as a abnormal labor, because something complication is going to occur during the third stage of labor. Okay. Next. And the last stage, nothing is going to happen in the fourth stage to the mother, but it is nothing but only observation stage. So after the delivery of the baby, we have to observe the mother as well as the baby to regain their normal pattern. That is, the fourth stage begins with the delivery of the placenta and ends 2 hours after delivery.
Okay, so during these fourth stage, we have to observe the mother properly, and also the baby, that is assessment and all you are going to carry out during this last stage. And when the mother is going to be a normal, no complications of the delivery is seen, then after 2 hours, the mother is going to transfer or shifted to the postnatal ward for the further care. Okay. Next, then again we how to calculate how we'll come to know the labor is going to start. So all maybe a familiar, there is a formula to know the expected due date of the mother delivery. Yes, so that is, it is unpredictable to foretell precisely the exact date of the onset of labor. So calculation from Nagel's formula is only a rough guide. It gives us what will be the date of delivery. It may be a before that, or it may be a after that calculated date. So based on the formula, labor starts approximately on the expected date in a 4%, 1 week on either side in a 50%, 2 weeks earlier and 1 week later in a 80%, at 40 weeks in a 10%, and at 43 weeks plus in 4%. So that is going to be a not normal, that is going to be a post-dated delivery, which can give the complication to the mother as well as the fetus. Okay, so when we know the LMP, last menstrual period date of the mother, we have to just add in that 9 months and 7 days, then we will get the expected due date of the delivery for that particular mother. Okay, next. Now, how the labor is going to start? What are the causes, or how the onset of the labor is going to take? Mainly there are 3 factors: mechanical factor, hormonal factor, and the neurological factor. Okay, so mechanical means what? The pressure from the uterus, the pressure from the descending fetus, the pressure from the fluid, amniotic fluid in the uterine cavity will give the pressure on the cervix, and the cervix is going to get dilated, and accordingly the mechanical force will give rise to delivery. The hormonal factor, that is various hormones are playing during the labor. As already we know, estrogen and progesterone already present during the pregnancy. Yes, so that is going to also help to induce the labor during the labor. And then there is a synthesis of prostaglandin because of these 2 hormones that will help for the induction of labor or starting of the labor. That is a hormonal factor. And the last is a neurological factor, that is alpha and beta receptors are helping to initiate the labor. Okay, next. Now this is a figure how we are going to have a hormonal factor which release or which help to start the labor. Next. Now this is a next. Now this is estrogen. As we said, already there is estrogen present during the pregnancy in the mother, which will help for the maintenance as well as the preparation of breast for the mother during the pregnancy. So increase the release of oxytocin. Because of estrogen, what is going to happen? There is an increase in the release of oxytocin from maternal pituitary. It is not there during the pregnancy. Okay, it is going to start only when the initiation of labor is going to start. Promote the synthesis of receptors for oxytocin in the myometrium and decidua. Accelerates lysosomal disintegration in amnion cells, resulting in increased prostaglandin synthesis. Stimulates the synthesis of myometrial contractile protein, which is present in the myometrium, that is called as actinomycin through AMP. Increases the exact excitability of the myometrial cell membranes. So because of that, there will be a contractions present in the myometrium. So this is the role of estrogen during the labor. Next. Now coming to the progesterone, as I already said, progesterone is there during the pregnancy and which is going to help the mother to maintain the pregnancy. So that is a very important hormone during the pregnancy. Increase the fetal production of dihydroepiandrosterone sulfate and cortisol that inhibits the conversion of fetal pregnenolone to progesterone, and progesterone levels therefore fall before labor because it is helping for maintaining the pregnancy. Now we don't want to maintain the pregnancy, we want the delivery of the fetus. So what is going to happen? There will be a imbalance between the production of estrogen and progesterone. So ultimately the progesterone level has to be got down. Okay, so that this hormone DHEAS will do the decreasing the level of the progesterone in the mother. It is an alteration in the estrogen and progesterone ratio rather than the fall in the absolute concentration of progesterone, which is linked with the prostaglandin synthesis. So what is going to happen? Because of imbalance of the estrogen and progesterone, there will be a synthesis of prostaglandin. Now prostaglandin has a role to initiate the labor. Okay, next. Now coming to the prostaglandins, are the important factor which initiate and maintain the labor. The major sites where the synthesis of prostaglandin is taking place, that is our amnion, chorion, decidual cells and myometrium. So these are the areas where the synthesis of prostaglandin is going to occur. Synthesis is triggered by, how it is triggered by rise in estrogen level, glucocorticoids, mechanical stretching in the late pregnancy, increase in cytokinase. If it is infection there, then also the prostaglandin is going to increase. Vaginal examination, separation or rupture of membranes. So if these actions are going to happen during the labor of first stage of labor, then there will be an increase in the prostaglandins, and ultimately these prostaglandin will help to initiate and maintain the labor. Now coming to the oxytocin. Oxytocin receptors, as we said, it is increased in the uterus with the onset of labor. Oxytocin promotes the release of prostaglandins from the decidua. Oxytocin synthesis is increased in the decidua and in the placenta, and because of vaginal examination and amniotomy cause rise in maternal plasma oxytocin level, that is called as a Ferguson reflex. So when we do the vaginal examination, PV examination to know the cervical dilatation, to know the position and all the fetus, then that will give rise to increase in the oxytocin as well as the prostaglandin level, which will help to have a normal labor. That is, a progress of labor will be in a proper way. Next. So I said the third factor is a neurological factor. So that is alpha and beta receptors which are present. Both alpha and beta adrenergic receptors are present in the myometrium. Estrogen causing the alpha receptors and progesterone, the beta receptors to function predominantly. So that is, estrogen is acting on the alpha receptors and progesterone is on beta receptors, and what will happen? The contractile response is initiated through the alpha receptors of the postganglionic nerve fibers in and around the cervix and the lower part of the uterus, because these mainly present, these alpha receptors are present at the lower part of the cervix. So when we go for examination and all that, then these receptors become active and then they will lead to dilatation of the cervix. Now coming to what are the premonitory signs we can see in the labor, that is labor begins in primi gravida 2 or 3 weeks before the onset of true labor pain. So mother is going to feel some symptoms during this period, and now she feels, the doctor will understand now there is a labor. Within some weeks the mother is undergoing the labor. In multigravida, it may come to know not few days but few days as well as the few hours also, depending upon the gravida of the mother. If it is a multigravida, then labor will start early than the other mothers. Next. So what mother will feel? 3 to 4 weeks of labor before, there is a lightening. So what is lightening? The mother will feel light. Okay. So during the 34 and 36 of pregnancy, the mother's uterus is going to touch the diaphragm. Yes, sternum. So mother will have some problems in taking the breath. So there is a shallow breathing. She will always feel the pressure on the diaphragm. Sometimes she feel the fullness of the stomach and all these things. So what happened the last 3 to 4 weeks? the uterus is going to descend down, yes, and because of that the mother will get released from all these symptoms, and now she starts feeling the light. So that is called as a feeling of lighting. So that is the first sign of descending the fetus, that is a lightening. There are some cervical changes and appearance of false pain start. So first we want to know, as we say, the first stage starts from the true labor pains to the full dilatation of cervix. So what is the, we want to know what is the difference. There are two types pain the mother can have, that is a true labor pains and false labor pains. So as a nurse, we want to identify what type of the pains the mother is having. Is it a true labor pains or it is a false labor pains? Okay. False labor pains. So we want to just go through what is the difference, how we can identify the true and false labor pains. The first is, in true labor pains, what happens? The contractions at regular intervals. So all the, starting from the labor, the contractions is going to have a proper interval and it is going to increase as the labor progresses. But it will not be present in the true labor pains, false labor pains. So what is a contraction at irregular intervals? So from that we can identify it is not a true labor pains. Engagement is present. So whatever the part is going to engage, that is the cephalic or the vertex presentation is going to engage into the true labor pains, which is not there in the false labor pains. Then there is a present of show. So as we know, during the pregnancy there is a plug formed in the cervix, which is going to released before the delivery. That happens incidentally. So that is present in, that is called as a show. Show is nothing but a mixture of the cervical mucosa and some blood. That is called as a show, which is not present in the false pains. Duration of pregnancy, duration of frequency increases over a time. That is a contraction frequency, which is not in the false pains. Dilatation of cervix is present. So as the intensity and duration of frequency is increases in the true labor pains, accordingly there will be a cervical dilatation takes place, which is not there in the false true labor or false pains. Pain not relieved with enema or sedatives. So most of the time we give the enema to the mother. So that will, if it is a false labor pains, that sometimes it get released. But if it is a true labor going to start, it is not released, but the mother will get more and more intensity and of the pain and the contractions. Intervals gradually shortens with the time. So interval is going to short and the intensity is going to increase in the true labor pains, whichever the false labor pain will not show these characteristics. That's why we say it is a false pain. So it won't indicate that labor is going to start. If there is a true labor pains in the mother, we can see all these things, then only we can identify now the normal labor or a labor is going to start or is going to coming. Next. Now what is the physiology of first stage of labor? What is going to happen? That is the fundal dominance. So what is meant by fundal dominance? The fundus of the uterus. Each uterine contraction starts in the fundus near 1-2 of the cornea and spreads across the downwards. So there is a fundus, there only the uterine contractions are going to start, then it is going to the down to the uterus. So what is the SA node in heart? No? It gives the impulses and then it goes to the parts of the heart. So same thing is going to happen here. The contraction lasts longest in the fundus. It is also most intense, but the peak is reached simultaneously over the whole uterus and the contraction fades from all the part together. Okay, so ek wave nigun jana, then again next after some intervals the another one is starts. So that is going to happen in the, that is called as a fundal dominance. Next. Now polarity is another term used in the normal labor, first stage of labor. So what it is? Polarity is a term used to describe the neuromuscular harmony that prevails between the two poles of the segments of the uterus throughout the labor during each uterine contractions. These two poles act simultaneously or harmoniously. The upper pole contracts strongly and retracts to expel the fetus. The lower pole contracts slightly and dilates the cervix, and the expulsion takes place. If polarity is disorganized, then the progress of labor will not be start. So once the contraction occurs, there will be contraction and retraction. Yes, so contraction and retraction. In heart, what is happening? Contraction and relaxation. So here relaxation is not there. What is there? Contraction and retraction. So once during the contraction the size is regained, that is going to remain. नाहीतर परत असं होत नाही. Okay, once the contraction occurs, the fetus is going to descend down. Then again it will not happen like this. Otherwise fetus again, what will happen? Again rebound back. Okay, so that is the characteristics of the uterine muscles, that is having the contraction and retraction. So because of that, the descent of the fetus is going to occur during the labor. Next, so this is the figure which you will show what is the contraction and retraction. So once the contraction is taken place, the retraction is also after contraction, retraction, the uterine size will be becoming less and less, which will help to expel the fetus through vagina. Okay? Next. Now during the labor, there is a formation of upper and lower uterine segment. So what is it? The upper uterine segment, having been formed from the body of the fundus, is mainly concerned with contractions and retractions. It is thick and muscular. The lower uterine segment is formed of the isthmus and the cervix and is about 8 to 10 centimeters in length. So a lower part of the uterus, that which includes the isthmus and cervix, is considered as the lower uterine segment, and above that it is considered as a upper uterine segment. The figure will show you how it is. The muscle content reduces from the fundus to the cervix where it is thinner. So muscles of the fundus will become a thin, which will help to have a more and more pressure to descend the fetus. Next. When the labor begins, the retracted longitudinal fibers in the upper segment pull on the lower segment, causing it to stretch. जसं बेबी खाली fetus खाली जाईल, त्यामुळे काय होणार? Lower uterine segment is going to stretch more and more. This is aided by the descending presenting part. So because of that, what will happen? The head of the fetus is going to descend it properly in lower uterine segment. Now this is retraction ring, which distinguish between the lower and uterine segment, lower and upper uterine segment. The ring forms between the upper and lower uterine segment. This is known as the retraction ring. You can see in the figure just. But if it is a very ring becomes a very strict, like a constricted, like, so that become a complication during the first stage of labor. Okay, that is called as a obstructed labor, where the fetus is not going to descend more. Okay, the physiological ring gradually rises as the upper uterine segment contracts and retracts, and the lower uterine segment thins out to accommodate the descending fetus. Once the cervix is fully dilated and the fetus can leave the uterus, the retraction ring rises no further. Okay, so once the fetus head is properly engaged or descend down, then the retraction ring will not see. Okay, but if it is obstructed, then there is no chances of more descent of the fetus. Then the surgical intervention will help to delivery of the fetus. Next. Now coming to the cervical effacement, important thing which is happening in the first stage of labor, that is cervical effacement. That what is meant by effacement refers to the inclusion of the cervical canal into the lower uterine segment. So in non-pregnant state or during the pregnancy, the cervix is a separate part from the uterus. But during the labor, as the labor progresses, what is going to happen? The cervix become a part of the uterus. Okay? As the fetus is descending down, the cervix is going to taking up of the cervix from both the sides. That is called as a effacement of the cervix. It takes place from above downward. That that is the muscle fibers surrounding the internal os are drawn upwards by the retracted upper segment and the cervical merges into the lower uterine segment. That is called as a taking up of the or effacement of the cervix. The cervical canal widens at the level of the internal os where the condition of the external os remains unchanged. Next. Now here you can see the clear picture how the effacement of the cervix or the taking up of the cervix is taken place in the second figure. Okay. Here you can see the cervix becomes a part of lower uterine segment. And in first, that is uneffaced cervix. Okay. So that is a separate cervix we can see which is attached to the lower part of the uterus. Okay. Next. Cervical dilatation is the process of enlargement of the os uteri from a tightly closed aperture to an opening large to permit the passage of the fetal head. Dilatation is measured in centimeters and full dilatation at terms equates to about 10 centimeters. So the cervical dilatation should be there from 8 to 10 centimeters to have a normal delivery. Then only the head will pass through the vagina, through the birth canal. Okay. Next. So here you can see how that is before starting the labor, it will not be a 1 centimeter also. So once the labor starts from 1 centimeter to it becomes a 10 centimeter during the first stage of labor. Okay. So from that then we can able to have a normal delivery of the baby. Now show, as I told you what is the show, that is the first sign of starting the labor. As a result of the dilatation of the cervix, the operculum which form the cervical plug during pregnancy is come out. The woman may see a blood stained mucoid discharge because first sign which is seen by the mother a few hours before or within a few hours after labor starts. The blood comes from the rupture capillaries in the parietal decidua where the chorion has become detached from the dilating cervix. So now there are chances of having the dilatation of cervix. Okay, next. Now there are the next. Now during the labor we can see there is a formation of bag of water. So what is nothing but a bag of water? The water which comes before the presentation, that is a presentation means what? Here is the vertex head presentation. In front of that whatever water comes in the bag. So that's why it is said as a formation of bag of water. So that is due to stretching of the lower uterine segment, the membranes are detached easily because of its loose attachment to the poorly formed decidua. With the dilatation of the cervical canal, the lower pole of the fetal membranes become unsupported and tends to bulge into the cervical canal. As it contains liquor which has passed below the presentation or presenting part, it is called as a bag of water. So it contains the two types. Two types means just for study purpose it is having the two waters, that is a which comes before the head, that is called as a forewater, and the water which is inside, that is called as a hind water. Okay, previous slide. So that is the forewater. As the uterine segment forms and stretches, the chorion becomes detached, that we have seen. Intrauterine pressure causes this loosened part of the sac of fluid to bulge downwards in the internal os and the depth of 16 to 12 millimeter. The well-flexed head fits snugly into the cervix and cuts off the fluid in front of the head from that which surrounds the body. That I said, the former is known as the forewaters and the latter is known as the hindwaters. जे बाहेर दिसणार आहे cervical canal मध्ये in the before head, that is called as a forewater, आणि जे नंतर असणार आहे त्याला hind water. जसं hind milk and fore milk असते की नाही? ओके नाही, fore milk means what? The which comes first, watery milk, त्या काय fore milk, and which comes after some time, that is called as a hind milk. So here is a same thing, forewater and hind water in the bag of water. Next. Okay, one of the factor which is responsible to have a labor, that is a general fluid pressure. So what is the amniotic fluid pressure present in the uterine cavity? That fluid is going to give the pressure on the membrane as well as the fetus, and which will help for the descending of the fetus. So that is while the membranes remain intact, the pressure of the uterine contraction is exerted on the fluid. And as the fluid is not compressible, the pressure is equalized throughout the uterus and the fetal body. So it is known as a general fluid pressure. This is one of the mechanical factor to give the pressure on the membrane, and because of that there may be a rupture of the membrane and descent of the fetus. Next. Now coming to the rupture of the membrane, this may happen in the first stage, end of the first stage, or starting of the second stage of the labor. Next. So fetal axis pressure, one of the important factor to have a normal labor, first stage, that is because the fetal is there in the longitudinal axis of the uterus, so that fetal axis is giving the pressure on the membranes, and which will help to have a cervical dilatation and to come for the normal delivery. Okay, that is the fetal axis pressure. Next. Now coming to the management, how we can go for the management of the first stage of labor. It's very important. Divided into nursing management, preparation of room for delivery, preparation of equipments for delivery, and maintaining the record or documentation of delivery. Next. So if the nursing management comes, there are important factors which we can take during this 12 hours labor or the first stage. The important thing is nursing management. We have to take care of the mother during this first stage of labor. Mother is panic, having the pain, intense contractions. So the important thing, we have to take care of the mother during this first stage of labor. So what are the things included in first stage of labor? If the mother is not admitted, because there is an Indian women pattern, जोपर्यंत पोटात दुखून मेम्ब्रेन रप्चर होत नाही तोपर्यंत बाई हॉस्पिटलला येत नाही ना. सो मॅक्झिमम दिस इज हॅपनिंग इन द पेरिफेरी. शहरामध्ये येतात बिफोर दॅट 2 days वगैरे एक्सपेक्टेड ड्यू डेट असेल तर दे कॅन कम अँड गेट ॲडमिटेड देमसेल्व्स. अदरवाइज इफ दे कम टू द अँटीनेटल क्लिनिक, then doctor get them admitted because the labor is going to come nearby. So that time they get, if the mother is not admitted in the hospital, so if she comes with the labor pains and all, first we have to go for admission of the mother. Okay. So that is a hospital admission. In that we have to collect the history of the mother regarding the previous and present pregnancy and labors. Then we have to go for physical examination of the mother, and if any investigation is required, if it is not done recently, then we can go for the blood investigation and ultrasonography. Then perineal preparation. In that we have to, the important objective of management of first stage of labor is to prevent the infection during the first stage of labor. Okay, as we are handling the mother now and then, every 2 to 4 hourly we are conducting the PV examination. Yes, for that we have to use the aseptic technique, because during this time there are chances of getting the ascending infection because of aseptic technique by the nurses or by the staffs in the labor room, that will give rise to infection to the mother and then can cause the problem in the postnatal period. So aseptic technique is very important while examining the mother. Then giving the enema, then we have to monitor the mother and the fetus. Both the things are very, very important. Then we'll go for see one by one in short. Okay, next. The important thing which we have to take care of the mother is pain. Nowadays the young girls don't want to experience the pain during the labor. Yes, so they prefer to have a painless delivery. Now there is a trend to have a painless delivery, or they can go for Caesar, because Caesar won't give an experience of pain. But if there is a vaginal delivery, then mother will have a pain, because there are the contractions during the labor, and the intensity of the contractions are going to increase as the progress of labor is going to take place. So there is going to be a pain for the mother. So how you are going to take care of this pain? You are not going to minimize the pain, because labor pain is going to increase. So how you will do that? And there are strict instructions. We cannot give a pharmacological intervention to minimize the pain, yes, because it may affect the fetus, it may affect the progress of labor, or it may affect the descending of the fetus and will cause the problem during the labor. So what we'll do as a nurse, what we can do, there are different ways to divert the mother's mind, yes, during this first stage of labor and during the pain. So what things we will do? Non-pharmacological, you can have a touch and massage. So nowadays in corporate hospital, not in our government hospital, but in corporate hospital, they allow the companion, yes, with the mother when the mother is undergoing the delivery. Previously it was not there, but from last 15 to 20 years, now they are allowing the companion. तुम्ही पिक्चरमध्ये पण बघितलं असेल ना, डिलिव्हरीच्या वेळेस हजबंड वगैरे अलाउड आहे पेशंट मदर बरोबर. सो दॅट विल हेल्प द मदर टू हॅव, पण कुठला पॉझिटिव्ह कंपॅनियन. सासूबाईला वगैरे ठेवलं आणि सासूबाई खडूस असेल, देन इट विल नॉट हेल्प द मदर टू हॅव अ good progress of labor. So you can ask the mother whom she want with her during the labor. Okay, मग ते बहीण असेल, आई असेल, हजबंड असेल. ओके, सासू पण खूप छान असतात, आईच असतात. कोणाला सासू आवडत असेल तर सासू ऑल्सो कॅन हेल्प फॉर हॅव्हिंग द ड्युरिंग द लेबर. So that is a touch and massage will help to minimize or the diversion from the pain. Counter pressure, pressure on hands, feet and lips. Hydrotherapy, nowadays the hydrotherapy is used. There are many researches which are done to have a effect of cold compresses or hot compresses on labor progress. So that is helping to just bear the pain during the labor. हॉट कॉम्प्रेस, जसं आपल्याला कुठे गुडघा वगैरे दुखत असेल तर आपण काय करतो, किंवा हॉट वॉटर बॅग किंवा काय तर. सो हिअर द सेम थिंग वी हॅव टू डू, ओनली वी हॅव टू टेक द प्रिकॉशन्स. The mother should not get harmed during this intervention. So hydrotherapy, then we have to improve the breathing pattern of the mother. Okay, so during the antenatal period only we ask the mother to do the deep breathing exercises. Yes, these are going to help the mother during the labor also to have a more and more oxygen inside. Yes, that will help to have a normal labor. Then heat and cold packs, then the positioning changes, relaxation technique, music also. There are many researches which have done to effect of music therapy on pain and progress of labor during first stage of labor. ह्याच्यावरती पण खूप सारे रिसर्चेस झालेले आहेत which means they have given that this effect of music really help the mother to overcome the labor and also they have a good progress of labor. So that is different types of music. Yes, then relaxation technique, music, focal points, then photos, extra aromatherapy is also working in this. Then fluid and light fluids, bird doulas are there. Acupressure also is helping to have a bearing pain during the labor. Then pharmacological not allowed to use, but there are some drugs which will help, that is analgesic and anesthetic and sedatives, but not allowed the mother to take during this period. Okay, next, then as the mother is in first stage of labor, we have to have a rapport with the mother, good rapport. Then explain all the procedure, not in detail, but mother should have an idea how the labor is going to occur. जर डिटेलमध्ये सांगितलं तर बिचारी घाबरून जाईल, है ना. 20 वर्षाची मुलगी, 21 वर्षाची मुलगी, सो शी मे गेट फ्रायटन बिकॉज व्हॉट यू टेल. So in short, we can tell the mother how she can cooperate with you. Now orient the patient to the surroundings, initiate the patient to the labor chart. Then history taking मध्ये तुम्ही previous history and the present history of labor as well as pregnancy you are going to take. On from that you are going to decide what type of labor is going to occur and how you are going to categorize the mother. Is it a high risk pregnancy or normal pregnancy? Next. Okay, as I said, the perineal preparation has to be done in the first stage or before first stage of labor. So shaving of pubic hair to prevent the infection or while giving the episiotomy. Okay, so that has to be done, but there are again researches are done. some mothers won't allow to shave the vagina and perineum, so there is clipping of the perineal hairs also can help to conduct the normal delivery. Only the motto is that it should not obstruct the labor and it should not give the infection to the mother while conducting the labor. So त्याची काळजी घ्यायची आपण. Next, then uterine contractions already I told. Next. Okay, now here we maintain the partogram. Everybody must be familiar with the partogram, which is maintained during the first stage of labor. So partogram is nothing but a graphical representation of progress of labor during the first stage of labor. Okay, so in that various things we are going to observe, monitor and draw on that partogram. So it will show you really the labor is progressing properly or there is an obstruction or there is a delayed progress of labor. Accordingly, as a nurse or as an obstetrician, we have to take the action. Actually, partogram is not maintained in the super specialty hospital because 24 hours the doctors are present, nurses are present, all the modalities to give the care, to attend the emergency labor is there. But in the periphery like sub-centers, PSC, rural hospital, the other things are not present to attend the emergency which may occur during the labor. So that time the nurses are maintaining the partogram which will give the immediate idea that the progress of labor is normal or obstructed is there or any delayed progress of labor. So accordingly that nurse will take a action, and before the complication mother is going to get the referral services or some super specialty hospital, the mother is going to get shifted. त्याच्यामुळे काय होईल, maternal and fetal complications are get minimized. Okay, next. So as I said, what is there in the partogram? The demographic data of the mother, the fetal condition or the well-being of the fetus by knowing the fetal heart sounds. Okay, so if it is a less than 120 and more than 160, which indicates what? That is a fetal distress. So we have to be in action now. Next is what? Maternal condition, again well-being by monitoring the vital signs of the mother, TPR, BP and all. Then the progress of labor by drawing the cervical dilatation, effacement and contraction patterns. That will give the idea of normal labor progress. Okay, and medications given during the labor. So we are not allowed to give the medication during labor, but if there is an induction, we have to do some maintenance drip of oxytocin we have to put for the mother. Nowadays compulsory in government hospital also I have seen each mother is going to get the oxytocin drip started to have a labor properly. So that the next session we'll have for induction of labor. So if it is any drug is given or started to the mother, we have to record on the partogram. Next, now this is a partogram you can see in your books which is given by the WHO. There are two lines, one is normal line, active line are there, and one is not showing the progress. So that is active phase and latent phase and active phase. If your graph is going to comes below that, then it shows there is no progress of labor or obstructed labor, and if it is between these two lines, it shows the normal progress of labor. Okay, you have an activity also to draw the partogram for the mothers, yes, during the labor cases. Next. So what are the advantages? As I said, you will come to know the labor progress. A single sheet of paper can provide details of necessary information at a glance. You are there with the patient for 24 hours. Most of the time, obstetrician is not there with the patient. So once you draw the partograph of progress of 8 hours or 10 hours, the doctor has seen this, then the person come to know what is the progress of labor. Patient la kai ajun intervention ची गरज आहे की now the patient is having the normal labor properly. So that will come to know from the partogram. I think in Vardha I have seen they have in their labor rooms, they have online partographs. प्रत्येक पेशंटचं ते मॉनिटर अटॅच्ड आहे त्यांच्याकडे कॉम्प्युटर सिस्टीमला अँड दे हॅव अ इज देर एनी इंटरेस्टिंग थिंग गोइंग ऑन? येस बॉयज? And then that will help to have a labor. So that is a good thing, they have an online partograph. No need to record labor events repeatedly. Gives clear picture of normality and abnormality in the labor. It can predict deviation from duration of labor, so the appropriate steps could be taken in time. So as their duration is going to be more and more than the normal, it's going to have a complication in the mother as well as in the fetus during the first stage of labor. So the first stage of labor is going to be a very, very observant for the nurses. The nurses has to observe each minute event in the fetus as well as in the mother. Next. Now coming to the next care during this first stage of labor, that is the elimination, bowel and bladder care. Yes, so bowel care we give the enema. Yeah? When I was a student, that time we used to give a soap and water enema to the patients, okay? But nowadays this is a ban and now they give a ready-made enema to the mothers. That helps for two advantages that has. The bowels are going to be get evacuated and empty, so the more space is given to uterus to get contracted properly and descent of the fetus. And another one, the fecal matter will be removed before delivery, so that will not cause the infection, yes, during the conduction of labor. And coming to the bladder, that is what, how you will take care of the bladder? The mother is advised to have a voiding the urine. Encourage the mother to void the urine, because if the bladder is going to get a full, that will again give uterine contraction, will give the pressure to the bladder, and sometimes there are chances of rupture of bladder. Okay, so we encourage the mother to have voiding the bladder or pass the urine. If not possible, mother is not able to go to the washroom, then we can allow the mother on waiting room or a table bedpan वगैरे द्यायचं. Otherwise we put a simple catheter. Sometimes, not in compulsory cases, sometimes we give a simple catheter to void the urine. Okay, next. And fluid, as I said, fluid electrolyte balance is important thing in the first stage of labor. So most of the time we give the mother a clear fluids. Okay, not any juice वगैरे असं देत नाही आपण, clear fluids देतो जास्त. का? If any emergency occurs, if any complications occurs in the mother or fetus, and if the mother may require the emergency LSES, yes, so that time what will happen, it will not be a contraindication to conduct the seizure. That's why we give the clear fluid to the mother, but not more in more quantity. Okay, some people give only ice packs to make a moistening the oral cavity, because सारखं हे देऊन contractions घेऊन mother becomes a dry mouth and all. Okay, exhaust होते mother जास्त, so that has to be overcome by giving some fluids. Okay, otherwise we maintain the fluid and electrolyte balance by starting the IV fluids. Okay, the positioning during the labor or during the first stage, we want to know how you are going to position the mother. Most, the ambulation is very important. Till the membrane is not ruptured, we can allow the mother to roam in the labor ward. Okay, so that has advantages on labor progress. It will help more descent of the uterus. It will fetus. It will help to bear down the pain. मदरला थोडं पेन मधून रिलीफ वाटेल चालल्यामुळे. So we allow the mother to have a walk in the labor ward. When I was pregnant second time and went in delivery in JJ hospital, माझं बेबी छोटंसंच होतं, पण ते उंदरासारखं इतकं हलत होतं पोटामध्ये, म्हणजे खूप पेन होतं. So I used to walk in the corridor of the antenatal ward till 5 AM. And after 5:30 AM I got it delivered easily. So that is a very, we can allow the mother to walk. in the ward, in the labor ward. You will not allow my mother to go a longer way. तुमच्या डोळ्याच्या ह्याच्यापासून तिने बाजूला व्हायला नाही पाहिजे. You should have a watch on the mother. Once the rupture of membrane is going to occur, you will not allow the mother to leave the bed or the labor cot. Okay? आणि मदरला जर तुम्ही वॉशरूमला पाठवत असाल तर you have to be with the mother. Okay? Sometimes what happen, immediately cervical dilatation takes place, we don't know, and sometimes there will be a delivery of the baby in the bathrooms also. Okay, so as a nurse we have to accompany the mother. So in that way, and most of the time we give the left lateral position to the mother to remove the vena cava block. So it will have a good blood supply to the uterus and all. Then, as I said, first important objective is the prevention of infection during the labor. So during the labor of first stage, you are going to use the aseptic technique. Next, during giving enema, doing the vaginal examination, giving the good clothes, autoclaved clothes to the mother, according to hospital policy. त्यांची काय असेल पॉलिसी तसं तुम्ही ते कपडे अलाउड करा. We won't allow the mother to use their personal clothes during the labor. Okay, so provide the good hospital clothes. Good म्हणते because in government hospital, in public hospital, we won't get a new clothes or autoclave clothes वगैरे, कारण खूप डिलिव्हरीज असतात. एका दिवसाला जवळजवळ 20-25 डिलिव्हरीज होतात. So we cannot have that much supply. But in corporate hospital, they take care of the mother. They have a separate labor gowns and all. So then in corporate hospital, they have a setup in the same room only. त्यांच्याकडे असं आहे की once the mother get admitted during the last period of the pregnancy, till she goes home, she will be in the same room. The environment is also not changed. Okay, so that is also a new terms are coming in the trend. So that how you are going to prevent the infections. Next. Then I said vaginal examination. It can be done by the obstetrician as well as the nurses who are full trained, has a experience in labor ward. They can go for they can do the PV examination during the first stage of labor, and they can see the effacement of the cervix, dilatation of the cervix, and recording on the partogram can be she has to do on the partogram. Next. Okay, this is not done in all the cases. Some cases this is done artificial rupture of membrane because of the pressure and all. Naturally the membrane gets ruptured. Okay, but if it is not occurring, then the artificial rupture of membrane we can do with the forceps or artiforceps. Okay, so there are some indications to do. So madam will tell during the induction of labor. Okay, and this has to be recorded on the partograph. कि किती वाजता, at what time the artificial rupture of membrane is occurred, what is the color of fluid during the, because as a nurse we have to observe the color of fluid. Sometimes there is a meconium passed, yes, by the fetus, so that will give again the high risk labor. Okay, next. Then emotional support, as I said, emotional support, making the mother, having the good touch with the mother, allowing the companion, giving the idea about the labor, making the mother during the first stage orient to the wards, sisters. कारण प्रायव्हेटमध्ये काय असतं, मदरला सिस्टरचं नाव वगैरे सगळं माहीत असतं, हु इज गोइंग टू कंडक्ट द डिलिव्हरी, कोणते डॉक्टर आहेत. सो ऑल दिस विल हेल्प द मदर टू गेट द इमोशनल सपोर्ट अँड शी विल कोऑपरेट थ्रू आउट द लेबर. Okay, next. Okay, so preparation of delivery room during the first stage of labor. As a nurse, we have to be ready with all the articles to be ready in the delivery room. Maintaining the environment, तुमचं वॉश चालू आहे की नाही व्यवस्थित, एन्व्हायरमेंट आहे की नाही फिटससाठी, बेबीसाठी ते बघायचं आहे. पूर्ण कार्बोलाइज केले का आहे, बरोबर ट्रे प्रिपेअर आहे का, डिलिव्हरी ट्रे. समटाइम्स एपिझोटॉमी इज गिवन नावडेज टू ऑल द मदर्स. सो एपिझोटॉमी ट्रे वगैरे हे सर्व ऑटोक्लेव्ड अँड ऑल एव्हरीथिंग इज रेडी, डन बाय द नर्सेस. सो दॅट हॅज टू बी डन. नाहीतर ऐन वेळेला काय होतं, मग पळापळ होते. सो दॅट शुड नॉट बी हॅपन ड्युरिंग द लेबर. नेक्स्ट. ओके, दिस इज प्रिपेअरिंग द इक्विपमेंट्स. ठीक आहे, नेक्स्ट. Okay, so sets with the delivery set, episiotomy sets, some medicines are required during the labor. Then IV sets, sometimes there may be a resuscitation required after the delivery to the baby, and everything has to be ready during the first stage of labor. Okay, so already I told what are the documentation you are going to do during the first stage of labor. So important thing is what? Maintaining the partogram. That will give you the whole idea of the labor and what is the condition of the fetus as well as the mother. If extra thing according to hospital policy has to be recorded on the paper of the mother, that has to be recorded. Okay. Now coming to the summary. During the first stage of labor, we have seen how the labor is going to start, what are the factors responsible to have a normal labor, of whom we can say a normal labor. Then we have seen what are the events are happening into the first stage of labor, how the mechanical, neurological and the hormonal factors responsible to initiate the labor, and how you are going to take care of the mother is important. Important is oxygenation is also important in first stage of labor. So mother's capacity we have to see, and accordingly we can start the oxygen also to the mother, maybe a 2 liter or 4 liters normally. So mother will not get exhausted during this 12 hours of time. Okay, so this is about the first stage of labor. When we'll have your practical, when you will deal with the patients, you will come to know more and more about the labor. Okay. So thank you. Once again, I thank you, the organizers, all the dignitaries of the Jadhavar Institute, Sheetal Madam, all faculties, and my dear students, your patience. कारण एवढा 1 तास पेशंट ठेवणं खूप कठीण आहे, ते पण मुलांना. मुली विचारे आहेत पण मुलांना एवढं पेशन्स ठेवणं खूप कठीण आहे. तरी पण तुम्ही इकडे पेशन्सली लिस्ट ऐकलं, सो थँक्यू. कारण माझ्याकडे 110 मुलं आहेत, 200 पैकी 110 मुलं माझ्याकडे आहेत गव्हर्नमेंटमध्ये. सो आय नो बॉईज कशी आहेत किंवा किती त्यांचे पेशन्स असतात मला माहिती आहे. सो ऑलवेज ते जास्त जरा हे असतात, नटखट असतात, ॲक्टिव्ह असतात त्याच्यामुळे. ओके, सो थँक्यू. Once again, thank you. Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am. The big secret in life is that there is no such thing as a big secret. Whatever your objective is, if you are willing to what, you can achieve it. Thank you, ma'am. Your training session is unmatched. Learning from you is a pleasure. Thank you for the excellent session. Good.